Could you have Lyme disease and not know it? Absolutely. Let's get into it. So Lyme disease is one of those things that has been called the great imitator because the medical community doesn't know a lot about Lyme disease. When I say medical community, if you go to naturopathic doctors or Lyme literate doctors, they absolutely do. But if you're just going to your regular MD, they're not well versed in it or versed in it at all, actually. It's just not something that they're trained on, which is unfortunate because there is likely a lot of people that are walking around being misdiagnosed. They have Lyme disease and they're being misdiagnosed with something else. Some of the misdiagnosis could be autoimmune condition. It could be MS. It could be chronic fatigue syndrome, fibromyalgia, depression, rheumatoid arthritis. There's so many things that you could be misdiagnosed with when, in fact, you do actually have Lyme disease. Now, Lyme disease, when you do get a bullseye rash, is easy to diagnose, but only 40 to 60%, and these numbers keep changing. Recently, I was told it was 40 to 60% of people will get the bullseye rash, and then a lot of people get bit by a tick because it is a tick that causes Lyme disease, but not everybody notices that bullseye rash, or they don't get the bullseye rash. So it's just not that easy to diagnose it. Another thing too is people that aren't seeing the rash, some of the things that happen immediately after getting bit by the tick are, fever, chills, vomiting, all of these symptoms which could indicate the flu. So you go to your doctor and you didn't get the bullseye rash, so you're just getting all of these symptoms of the flu, but when in fact it is Lyme disease. Now, if you get on antibiotics early, like within the first few weeks of getting Lyme disease, then your chances of going into remission are a lot higher. But again, if you're not getting the right diagnosis, then how do you know what you are treating? So left undiagnosed, Lyme can lead to joint damage, brain, nerve issues, heart disease, severe fatigue, and a lot of things too. With Lyme disease, the fact that Lyme actually attacks your body and creates inflammation in your brain can also be misdiagnosed as a mental illness. So this is something else that we need to be looking at. So Lyme basically is a bacteria. It's a Borrelia. So I say that right? Borrelia. Yes, it's a bacteria. And then the tick bites you and you get that bacteria in your body, which of course causes all of the symptoms of Lyme disease. So Lyme disease attacks the central nervous system as well as the brain, which causes inflammation in the brain, which can lead to mental health issues. So if you know that the issue is Lyme, then you can take the proper measures to eradicate Lyme and the cofactors from your body. Whereas some people are just being, diagnosed with depression or anxiety or any of those things that could be coming from having Lyme disease. Well, Prozac or whatever your doctor's going to prescribe to you is not going to help you with the Lyme disease. It's just going to Band-Aid it. So I just want to make people aware, and I'm not saying everybody should go out and get tested for Lyme disease, but if you have some of these symptoms and you have this ongoing, like fibromyalgia, it can be Lyme disease. Chronic fatigue can be Lyme disease. If you're experiencing these things or your doctor is giving you these diagnoses, then I would recommend going and getting tested for Lyme disease because you could then start treating the actual problem and in hopes, get to a full recovery. Now, this is questionable. Some people say you can't get to a full recovery, but there are people out there that have gotten to a full recovery. So I'm a glasses always half full, not half empty type of person. So I believe that you can. And I'm on this journey myself right now. If you want to check out some of my other videos, there's mycotoxin illness, which I've also been diagnosed with, which I am tackling. But go and check some of those videos out. This video is just specifically for can you be misdiagnosed and can you be walking around with Lyme disease and not know it? And the answer is yes. So we have to be our own advocate. You have to dig in a little deeper because Band-Aiding it with something is that's just all you're going to do for the rest of your life is Band-Aiding it when you know that you could possibly get to the root cause of it. So anyways, the next question is, how do you know? So what tests can you get? Now, again, I recommend you work with a Lyme literate doctor or a naturopathic doctor. to get these tests done. And I understand that these tests are not cheap. They can get very expensive. So talk to your doctor about that, whether, you need a payment plan, or maybe they will diagnose you based on your symptoms, and you can just try some of the protocols and see if it works for you. But if you're interested in getting some of the tests done, so basically a few of the tests are the ELISA test, the Western blot test, Vibrant Wellness Tick 2.0 is the test that I got done, and it showed me everything that I currently have and the cofactors, and it basically tests your antibodies. So anyways, I hope that helps. That I hope that even if it's just one person who sees this video and it's like, oh, that is me, and you go get the test done, and then you can start your path to recovery. So I don't think there was anything else that I wanted to touch base on here. No, I think that's it. So if you are struggling with Lyme disease right now, or you're on a protocol, or you're doing something that is making you feel amazing, or maybe not amazing yet, but you're feeling better, I'd love to hear about it in the comments below. And don't forget to hit subscribe so you don't miss out on any of my latest videos. All right, have a good one. Bye-bye.